So thank you for having us, and I think before we move on to the panel, I think one thing is very clear. Ali just mentioned about self-love, but I think now from self-love we will move to something more, beyond self-love. So as we navigate through our healthcare, the way the healthcare is growing, and what I believe now is it's very clear that when we talk about sustainability, it is not only about personal health. There is a very close connection between, health, the environmental sustainability, as well as social responsibility. And the choices that we make today, whether we talk about healthcare policies, whether we talk about healthcare strategies, whether we talk about lifestyle management, whatever policies that we, or whatever choices that we make today, are going to not just impact us, but also the future generation, and at the same time, not just an individual, also to a community. And when we're talking about, this is more like a domino effect, that from an individual to the community, from the communities, eventually it's going to affect the environment and our planet. And today when we are seeing that there is a very, a sudden surge when we talk about lifestyle diseases. So I think what we eat, our lifestyles, the management, all of that is having a bigger impact. And I think talking about sustainability is very, very important right now. So I think we have a very esteemed panel today who are experts in their field. So I believe very strongly that whether it's policies, whether it is, whatever strategies that you come up with should be done by the people in the business who are running the show, because they'll be the right people to make the right policies because they know where the gaps are. So I think I'll directly move to my questions. My first question would be to Mr. Roy, Mr. Indranil Roy, that we are talking about sustainability today. Can you define what, according to you, is a sustainable wellness, and why it is crucial for the future of medicine?
Okay, good morning, everyone. First and foremost, heartfelt thanks to the organizers, to Bhakti and my fellow panelists, and mostly to you who are here to, attend this session. So, sustainable wellness, the primary difference between sustainable wellness and the general wellness. So in my view, in simple language, sustainable wellness is a holistic approach to physical, mental, and emotional well-being, which is proactive, which is preventive, taking into consideration the sustainable factors of environment, society, and ultimately planet. So that, in my view, what do I mean? May not be a textbook definition, but that's what I understand from sustainable wellness. Now, when I talk about the physical, obviously, many of us do that. The physical is the way, what you eat, your nutrition, the workouts, you go to the gym, you go for a walk morning, evening. That's the physical part of it. But there is a very important mental part of it, the mind part of it, which is so very relevant in today's world. Because our lives, as we go in our professional life, it is full of stress, it is full of challenges, it is full of anxiety. So it's extremely important to take care, to master that. So how you master that, your mindfulness, that's very, very important and critical. And hence, it becomes the most important part, because no matter how much you work, how much you work out, unless you are able to manage your stress, it's going to harm you. Okay? So that's one. The other important thing is the emotional part of it, creating those e-connects, be it at the workplace, be it in the family, be it in the society. Because when you have those e-connects, you will feel happy, you will feel better, and that will impact your health as well. So those are the very important things in my view, and definitely the environmental part of it, because you have to take care of good, clean air. So you have to encourage the environmental sustainable practices, because ultimately, whatever I do for myself, if the environment is not healthy, if the environment is polluted, like in many of the modern cities today, I can't refrain from breathing the air. So what quality of air I am breathing, what quality of water I am drinking, I need to be cognizant of that and need to be respectful and take steps in that proper direction, not only for me, but as well for my future generation.
Thank you so much. So I think I'm going to come back to you again, but before that, I would want to now ask Dr. Yashwant. You're from a hospital background. You are leading, organization. Now, today, when we talk of healthcare industry, when we are talking about whatever management that we are doing, it comes with its own set of environmental footprints. So, so as at a hospital level, if you could tell me how you could, maybe reduce waste or help improve energy consumption, and try and reduce these carbon footprints. So, yeah.
Yes, Bhakti. I mean, before I get into the exact measures that are to be taken in the hospital, so I would just like to emphasize on the fact that the healthcare sector has a significant environmental footprint. And just to give you guys a bit of statistics, globally, around 4 to 5% of the global gas emissions are contributed by the healthcare sector alone. This is the global statistics. And as per the US healthcare data, the healthcare sector in US individually is contributing to around nearly 10% of the overall carbon emissions. So you can look at the magnitude of the issue, what we are facing at. So what is exactly causing to this kind of magnitude in the especially from the healthcare sector or the hospitals? Primarily, if I can just jot it down into 3 broader segments, it will be the resources that are utilized to provide this infrastructure as well as to run the operations of the hospitals and healthcare sector. The increased amount of energy consumption which is required, again to run the operations, and the amount of waste that we generate, which is inevitable. As a part of infection control practices, it becomes inevitable. That is a hard reality which we have to face. Now coming down to the measures that can be taken at the hospitals or in the healthcare sector to improvise on this. So again, when I say the first point is about the resource allocation or the planning of a hospital. With the rapid expansion and the demand for healthcare services across the globe, we are tending to increase the number of hospitals that are being built in the recent era. So there is something called as green building concept. And we might have heard about the green OT as well as the green hospital initiatives, right? So there are certain certifying authorities and regulatory bodies. One of them, to name it, is the Indian Green Building Council. So when we are planning or when we are commissioning a hospital, we need to take care of all the parameters that what these regulatory authorities suggest to us. That will definitely help us in building an environment or building a building which is environmental friendly as well as sustainable. That is point number 1. And suppose if I am just building a particular 150-bedded hospital or something like that. So just the infrastructure, the way I design it, if it is well lit from the inside, that itself reduces the amount of electricity that I use within the hospital. So that itself is a cost efficient as well as sustainable measure. So certain things to do with infrastructure. Next, about energy efficiency, the most important one. So when I talk about energy efficiency, of course it will always boil down to electricity. And in hospitals specifically, 70% of the energy load is driven from the HVAC system. HVAC is nothing but heating, ventilation and the air conditioning system, which is very much essential and an integral part of a hospital facility. So there are now many more methods where we can, for example, VRV systems, VRF systems, which are energy efficient. And whenever we are planning or buying facilities for a hospital, we need to be very keen as administrators and look into these things so that directly the energy is being conserved. Next important point is about the water and the organic waste. So like I mentioned, we generate a hell amount of the waste in the hospitals. There is something called as composting or recycling measures. So if we are adopting those measures in the hospital sector, that itself contributes to a lot of energy efficiency. And water is a very valuable resource. We have something called as STP plants and ETP plants, you might have heard in the hospitals. Yes. So if we are able to recycle water from there and could be utilized in places like flushing facilities. Exactly. So if I can just give you a calculation of a 150 bedded hospital, it will at least save me 30,000 liters of water in a month, just by doing this kind of measures. So I believe all those measures are there, and if we implement it, we will be heading towards a much more sustainable
Yeah,
environment.
that was very nicely collated by you, doctor. So even in our hospital, it's a 750 bedded hospital. So you can imagine the waste that is generated, the energy consumption, as well as the water requirements. So yeah, even we do have these things in our system. And an additional thing, there's one more waste which is coming in, which is the food waste, which we don't realize. You know, the food wastage which is happening, the way we foil our food, the cling foils, the aluminium foils, and the wastage that the patient is doing. So I think somewhere that aspect also needs to be considered, because I'm a nutritionist, I believe
Absolutely.
there's a lot of work that we can do there. So yeah, thank you so much. I think I'll move to Dr. Sanjay now. Now, I'm sure you must be dealing with humongous number of patients, cancer patients, and we know that a lot of these patients, treatment is necessary, but as a part of treatment itself, that the patient goes downfall. The treatment, the quality of life, that the patient will have post the treatments. And I feel one of the major factors here is that their nutritional intake is not taken care of, or if not taken care of, is what is going to impair their quality of life. So I think I would just want you, if you could highlight the role of how nutrition and lifestyle plays a role in long-term health, not particularly only cancer, but in long-term health, and how we can integrate sustainable nutrition practices into preventive health care, which can benefit both the individual as well as the environment.
Okay, thank you. Good morning to everybody. I answer that in sections. Regarding diet and lifestyle, first we have to understand what you give to the environment will give back to you, remember. So it is always a symbiotic relationship. If you give something back to the environment is also going to give you something back. Okay, so starting with diet. Food which is rich in red meat. What does red meat cause? It causes slowing of the bowel motility. So the amount of contact time of the red meat with the bowel wall is prolonged, and that is how cancer originates. Vegetables. If you have less green vegetables and fruits which are full of antioxidants, your chances of getting chronic diseases increases. Nowadays, what is also happening is lots of pesticides and herbicides are being used for growing vegetables and fruits. So we really need to wash the vegetables well before eating them. Food which is rich in polyunsaturated fatty acids are also a highly risk factor for development of cancers. Tinned food, food with preservatives. What these preservatives do is that when you are actually again cooking them, any kind of tinned meat, they generate carcinogens. Like a lot of tinned meat especially. Carcinogens are generated in the stomach, and so you are subsequently going to develop cancer. Then what about lifestyle? Maybe a little bit of lifestyle. Obesity. Sedentary lifestyle nowadays. That is becoming a major risk factor for development of obesity. Obesity again is responsible for certain cancers in the body. Talking of lifestyle, let's come to smoking. It is rampant. There are 3 types of smoking. First hand, second hand, third hand. We never discussed this. You know what first hand smoking is? She's smoking. I'm sorry. Okay, I'm smoking. Okay, so what is smoking does? Smoking is full of carcinogens. It's like it's dripping in carcinogens, and they're putting all those into your body, right? And these carcinogens can cause cancer anywhere in the body. Then what is second hand smoking? I'm smoking and he's inhaling it. Second hand smoking is worse than first hand smoking. So actually, if I'm smoking, all of you should be actually coming and killing me, because I'm affecting your health in a worse way than I'm affecting my health. What is third hand smoking? Nobody talks about it. You've smoked a cigarette. Now the particles have come into the air and they have now settled down. Where? On the table, on the curtains. Now you're touching that, and you're again putting it on your face, and you're inhaling it indirectly. That is third hand smoking. So diet and lifestyle is responsible, ultimately bad diet and bad lifestyle, responsible for 3 major chronic diseases: cancer, diabetes, and cardiovascular disease. Cancer, in fact, India is going to be declared the cancer capital of the world very soon. So we must all be aware of it. Now, coming to the second, I'm sorry I took a little long. Coming to the second part of it, how to, what was the question? Sustainable, preventive care. So one is we can encourage the use of lots of green vegetables and fruits which are seasonal and which are locally produced. Okay, so that cuts down transportation cost and all that, and also allows the local industry to flourish. Use more of plant-based proteins rather than animal-based proteins, because these animal husbandries, which are where the animals are getting reared, that is one of the major reasons for green gas emissions in the world. Huge. Okay. What is the third part we can do? We can encourage the use of also fish from sustainable fisheries. About food, she spoke about food wastage. We have to encourage the use of food in small portions. Eat as much as you want to. Store the food properly. Do not let it go waste. And even if there is extra food, you try to preserve it in such ways that you can eat it again. So what happens? The per capita consumption is decreasing. So the strain on the food resource and food resource is also diminished. So one more thing is we can use a lot of collaborative networks to encourage these activities, because single voice is not going to be helped to multiply the message across. And all these activities will ultimately have good impacts on the health of the people. How? It is going to reduce the risk of chronic diseases. It is going to build up a robust immunity, and it is also going to give a good mental health. And environmentally, it will reduce the strain on the land resources, the water resources, reduce the pollution and the carbon emissions.
Very nicely, you've correlated everything very nicely. So thank you so much for that. Moving to Mr. Roy. Now, you work with a dialysis care center, right? And today we know that it's a costly affair because patients are going to be on dialysis for lifelong. And when we are talking about sustainability, we are talking about these measures, there is one part of inclusivity. So I think if you could just quickly elaborate on some part, how as a healthcare, when we want to be sustainable, we also try and be a little more inclusive to the sections or communities who are neglected.
Yeah, so when we try to create something special which is different from normal, there are many times that it tends to be niche and we don't stay inclusive. So it's extremely important. So if we have to ensure that sustainable wellness should be inclusive so that it does not restrict the marginalized communities' access, then let's break it into two parts. One is how we plan it and how we execute it. So very simple, if we have to plan a sustainable wellness which should be inclusive, we will have to allocate resources, all types of resources, be it financial, human capital, whatever it is. Resources to a program which is preventive, proactive, integrated with the public health programs. The government has taken multiple initiatives, and these need to be integrated at the ground level with the community centers, keeping in mind the various diverse culture we have in our country, the traditions we have in our country. So funds need to be allocated. We need to engage more with the community centers and the community leaders, the mohalla clinics, the rural clinics, take help of telemedicine and integrate the overall wellness and preventive care into the overall health policies and the philosophies of the country. That's one. So that's the planning part of it. The very important part is only planning won't help. Many times we are great planners, but the plan fails due to execution. So execution is the key. So when you look at execution, the first step is to train the healthcare workers on the diverse culture and traditions and the emotions that exist in this large country. So once you train them, it is possible to develop programs which are relevant, which respect those cultures and traditions. Those are not foreign to those particular marginalized community, right? So they exist and they can then be practiced to do that. For example, the ASHA workers can be trained on how to, counsel people on nutrition or be it mental health. how to counsel people, because why I'm saying ASHA worker, the government really has a huge workforce of that. So that can be utilized at the ground level, at the rural level. That's one. The second part of it is, when you execute, it is possible because in today's world, the genomic studies, the AIs, all those things are there. It is possible to develop specific tailor-made programs for for every community at every part of the country, and then practice it so that execution will be better because people will feel it is my program, it is my tradition. So that's the second part of it. The other important part is, for the government to ensure for the preventive health, more and more health checkup clinics, disease screenings, primarily Dr. Sen spoke about, diabetes, cardiovascular disease, cancer screening, available more vaccines. So all those things can be taken into account, and mental health, I feel, is the key because mental health leads to many other stress-related factors.
True.
So these are the ways, we can design a sustainable wellness program which is equitable, which is inclusive, and which takes care of the overall wellness as well as it takes care of the society and the planet.
True.
Thanks.
Yeah. So I think whether a private sector or a public sector, I think a lot of healthcare hospitals do realize this, and they are getting into the community reach programs. So I think that's the need of the hour, and I think that is what can help us, to reach out to all the communities. So yeah.
Sorry for that. There's another huge benefit which I thought I must mention. When you look at such programs, because prevention is always better than cure, but apart from that, there is going to be a huge economic advantage. We see that in every year's budget, government allocates a huge money for the healthcare. Now, when you do a sustainable wellness, the healthcare cost burden, be it on the government or be it on the out of pocket, is going to come down significantly. And that money can be utilized for developing the country in other ways. So that's another huge advantage.
Very good. Yeah, very, very nicely pointed. I think you spoke about AI, so I'll move to Dr. Yashwant now. Today we are seeing there's a boon of artificial intelligence, AI, whether there's telemedicine, there is personalized healthcare, there are technology which is there to support. So the transition towards more sustainable. So I would like to know your comments on that. How do you look at AI?
Okay, I think in this room, I can spot a lot of Gen Zs sitting over here. Probably the word technology is something which we understand more as healthcare professionals. But when it comes to AI and the social media platforms and other things, probably you guys are the better people. But having said that, as an administrator, I tend to meet n number of vendors who are trying to come and approach to us regarding the latest updates in the market, as well as a lot of research and development happening when it comes to using the AI based algorithms as well as tools. It could be to do with the decision making sometimes, or it could be to do with reducing the commuting aspect specifically.
Collating the data.
Yes. So when we talk about how exactly this is helping us or transitioning us towards sustainable healthcare. So quoting a few examples. Primarily when it comes to technology, yes, in hospitals and healthcare sector, specifically it's about the electronic health record or the electronic medical record. So if a hospital is able to have that completely full-fledged, so there is no need for a paper-based system.
Yes,
and it's a direct attributable measure that you are reducing the whole lot of carbon footprint in the atmosphere. That is the primitive and that is the most important measure. And next, when it comes to telemedicine, it has been in practice since long, and we have all of us have passed
thanks
the COVID.
To COVID.
Era.
Thanks to COVID.
Yeah, thanks to COVID for that. So it not only increases the access of care for the patients who are remotely based, but it also reduces the commutation part, the travel part. So a whole lot of stress, anxiety related to that, and the logistical arrangements are all taken care. So directly it's a technological connect, and it benefits both the environment as well as the patient and the doctor. So that's how it works. And specifically a few more examples to do with the AI based system. So in our hospital we have recently implemented, like I said, there's a lot of research and development going on in this particular field. But one example to quote, in any hospital, around 10 to 15% of beds are the actual critical care beds. Okay, that is the ratio. But if there is a patient who requires something intermediate care between the wards and the ICU, so either the patient has to bear the brunt of the ICU cost by being specifically there, and that is also depending on the occupancy level.
Right.
So in that scenario, and suppose I'm just considering a geriatric patient who doesn't wants to be disturbed but has to be monitored aggressively every 2 hours. So we have implemented one AI-based algorithm, which measures the early warning signs and all the vital signs, just like it is done in the ICU. So that once the patient lies on the bed, so you are the vital signs are directly captured, and that comes on the system. So this is the way it helps both the patients as well and the environment as well directly.
Yeah, great. Really nice. I think coming to the end of the session now, we spoke about the problems, we spoke about the solutions, which can help us, going ahead in future. But a last thought from your end, Dr. Sanjay, what do you think we could take as immediate measures, something which we can, do right away? Because all the things that we spoke about requires a lot of planning, execution, work to be done. And yes, there are organizations who are already working on it, but at an immediate point, if we have to start off, what can we do?
Thank you for the question. So we have to approach the people on the ground. And who are the people on the ground? The healthcare professionals. So first thing, I think we should educate ourselves properly, because we are all aware, but we do not have the correct information, the full information of how health and environment are closely correlated. So that needs to be, and the message has to go out. Second is, the healthcare professionals can act as role models. That is, they have to lead by example. For example, if I have exercise bicycle machine in my chamber and the patient is walking in and they are seeing that helps. The message goes across. Also, the leading by example is, if I use transportation in the form of cycling or walking down to my clinic, or if I am using sustainable dietary habits, that itself start as a starting point. So we have to be the starting point, the healthcare professionals. So it has to start from home. Charity begins at home. So home, community, and then has to go out. Third thing is, we are trusted. Whatever we might be goofing up in a lot of healthcare delivery, but at the end of the day, when patients come to us, they trust us. So we have to convince them. We have to tell them about good dietary habits. We have got to give them good lifestyle choices. We have to inculcate good preventive habits in them right there and there when they are coming to the chamber. That is the starting point again, because this message will go out to, they will talk, they will listen, and they will talk about this to other people. That's how it multiplies. Fourth is reducing the environmental impact of care. One is telemedicine. Dr. Yashwant has already spoken about. Another is, we find a lot of patients, in millions actually, in Bengal. They're going to Vellore for treatment. They're going to Tata Memorial for treatment. I go and convince them, you go, fine, you've taken opinion, but there's no point. All the facilities, all the treatments is available there in Calcutta. I'm from Calcutta. So, you reduce the transportation costs, you reduce the carbon emission, there's no requirement. So you encourage them to take local care. Another thing is digital prescriptions I'm also using nowadays, not using paper. So that reduces the carbon footprint again. And just last but not the least, use of collaborative networks. I've already mentioned earlier. I've worked with the Rotary groups, and they have these facilities where you can make the message, loud, in a louder way. It will reach the public. That's it. Thank you.
Thank you so much for this very insightful session. I'm sure the audience must have gained a lot of. It must have been very fruitful. So I sincerely would like to thank the esteemed panelists who are here, who have helped us through their expertise. And I think just the last ending line would be that the future of healthcare lies in collaboration, innovation, and commitment to sustainability. So I think we just need to be committed towards our efforts, and I'm sure we'll be able to make a difference. Thank you so much.